I have like hundreds of patients who have big nodules who decided to do nothing. They decided to put up with the fact that they can't swallow bread, they can't swallow pills, and that they have to sleep on their side, otherwise they can't breathe. But I have like hundreds of them, so I get to see the natural history of this. There are a lot of vague symptoms that can be attributed to it. First of all, cough is the real stinker, okay? People go to the allergist, primary care doctor, ENT, pulmonologist, all four of those, and they get multiple doses of antibiotics for sinusitis. Unfortunately, nobody does an ultrasound. They do a chest x-ray, and they x-ray the sinuses. But, the thyroid's part of the respiratory tract. They cough, the nodule gets missed. But the other stuff is more vague, like dizziness, for example. If you have a nodule that's big enough, it compresses the internal jugular vein, which causes back pressure up into your brain. Do you know about this already?
I experienced that. I would turn my head to the side and feel like I was going to pass out.
Well, if the nodule is big enough, it compresses on either the internal jugular, or if it's a nodule that's in your chest, it presses on the superior vena cava. That's draining the blood that comes out of your brain. So if you block that, all the blood backs up at the base of your brain and causes dizziness.
Oh my goodness.
So yeah, you can see a lot of people who are dizzy all the time, and they get better when you take care of their thyroid nodule. That's why it bothers people so much. It's blocking a whole bunch of stuff. And then the final thing is when you lie down, if any of your nodule is in this direction, if it's down below the clavicle, when you lie down, your diaphragm pushes up on the lungs and on the thyroid, and it shoves the thyroid up against the collarbone, the clavicle. So that's why you choke when you're lying down, because your abdominal contents are pushing up on the diaphragm. It's like a cork stuck in a champagne bottle. So you find a lot of vague symptoms and you're like, no, that sounds like your thyroid. The location of the nodule makes a huge difference. If the nodule is big enough, you hardly have to shrink it at all in order to relieve the symptoms. Tell them about that one guy we did.
He had a very raspy voice because of the nodule. We did the procedure on a Friday. I called him Monday, and he was, I already started feeling better. A month after the procedure, his voice is still hoarse, but it is better. He doesn't have so much fatigue when talking, and he is super happy. I mean, the volume has decreased already just 1 month, so I cannot wait for the next visit and see how he's going to be doing.
I think if the nodule is pressing on a critical structure, one that the patient has noticed kind of suddenly, it doesn't take long for the symptoms to get better if you do the RFA in the right place. When you're talking about voice or choking or trouble swallowing, you don't have to shrink it that much to get the relief.
That was my experience. I was so shocked that within a week I could swallow better, could not lie down without feeling like my airway was just completely closing off. So I was having to sleep nearly sitting up. I would cough after meals for about 30 minutes. My voice was much lower than it is now and raspy sounding. I used to sing soprano in college choir. I could not do that anymore. That started to get better. I was very surprised, but it must be, as you were saying, Dr. Interlandi, the fact that it was so large and it was pressing on all these structures, and just some small reduction immediately started to relieve that pressure.
Yeah, well, think about it this way. Stuff in your neck can move around a little bit to accommodate the nodule, right? But there's
not much space in there.
No, there isn't. It's a bony ring. Consider the sternum, the clavicle, scapula, and your spine, kind of a bony ring that's shaped like this. And there's just only so much room. And sooner or later, the thyroid nodule has to go down or up. If your neck is really long, it might go up, but oftentimes it goes down, and then it starts pressing on those vessels. And then you get these weird neurological symptoms that have to do with high intracranial pressure. We even have a test for this. It's called the Pemberton's maneuver, which, do you know about this?
Yes, put your arms up like this.
Yeah.
Yes, I felt like I had a noose around my neck when I did that.
Yeah, put your hands together. And if you get dizzy or you feel like you're being choked or it makes you cough, that's a positive Pemberton sign. That means your thyroid's too big. Yeah.
You know, I cut my own hair. It's just a hobby of mine. And I got to the point for a very long time, I would be cutting my hair, being like, I couldn't breathe.
Wow.
And when I got to the point where I could cut my own hair again, I was like ecstatic.
Thanks so much for listening. Please share this content and help others. If you need resources, testimonials, and support, please join our patient community. Save your thyroid. You can also find me on social media and Substack under the media handle It's Me Jen Again. Never forget to educate yourself and be your own advocate and save your thyroid.